Hello, everyone. Today we are here with Dr. Vincent.
Dr. Vincent is a family medicine doctor based in Brea. And today, Dr. Vincent, we're just here to ask you a few questions. So thank you for being here today.
I'm happy to be here.
Okay, first question. What originally drew you to medicine and what led you into your specialty?
Um, the honest truth is, I was a kid that grew up in Irvine and surrounded by ambitious kids. And both of my parents were family medicine doctors. So I watched them, and I honestly thought the job was terrible when I was growing up. I thought it was a lot of hours. I was annoyed that I didn't get to see them as much as I wanted to, and I couldn't go to Disneyland as much as I wanted to when I was a kid because they were always at work. But I saw what they did. I saw what their job meant to the people they were taking care of, and that just always sat with me and made me think about medicine. Um, when I was in college, you know, I thought about medicine, but I also didn't know much about what other jobs were out there in the world. So I did a lot of volunteer work and research, and I wound up working for the Alzheimer's Association and in event planning. And it was great and it was fun. And one of the events I did was I did a art class for people with dementia. And I loved it. I got to really bond with those people, but I felt like I was restricted in what I could do for them. And that feeling of being limited, I just didn't settle with me. And then I just thought, well, you know what? What they need at the end of the day is help with their health care. And so I'm going to bite the bullet and go into medicine. What led me to choose family medicine over internal was, I liked the spectrum of age range. I liked, seeing someone that was really sick and old with a lot of chronic diseases and cleaning up their medicines, and then also like getting the breath of fresh air of seeing a newborn baby or like a little kid or something like that, just to mix things up. Also, family medicine, it's much more hands-on than internal medicine. There's a lot more room for doing procedures. Not so simple, but more fun for me that I see pretty commonly are wounds. I run a mini wound care clinic too. And so that's like one of my ways to do procedures. So diabetic foot wounds are something that I see pretty regularly that are fun for me.
Wow. Yeah, I think that's very an uncommon thing that a lot of students don't see is that journey from possibly being disinterested to eventually even going into it. So I think that's a really, really unique answer. Thank you.
Thanks.
What does a typical day for you look like in family medicine?
Typically, I wake up pretty early, around 5. I try to go to the gym if I can. And then I usually leave the house around sometime between 6:30 and 7 to get to work because my commute's kind of long. I get to the office 30 minutes before patients start coming in so I can do some charting. And then at 8, our doors are open, start seeing patients in the morning. Um, and then depending on the day of the week, in the afternoon, I'm either seeing patients in the office or I'm out doing home visits throughout Orange County for the patients who have transportation limitations or like physical disabilities that make them homebound.
Do you have any specific parts of the day where you like more than others?
Um, I really like doing the home visits. So my days where I get to do a home visit, it's nice. Because I guess that's where I get to overlap my experience in social work from the past with my experience in medicine because I get to assess, what is a person's living situation like? What is their life outside of the medical office like? And I get to see for myself social factors that limit them from being able to take care of themselves or follow the instructions that we give them. Um, and try to solve those extra issues that are beyond what we're taught in med school or beyond what was like your doctor typically tells you.
Okay, next question. Did you ever feel burnt out of your specialty? And if so, how did you manage it?
I felt burnt out so many times at this point. I think the first time I felt burnt out was in med school with um, when we were studying for our board exams. It was just, it's a grueling schedule. Depending on how your academics are set up with the med school you're at, a lot of places it's like you take like 2 to 6 weeks off and all you're doing is studying from the second you wake up to the second you go to bed. And you don't see any sunlight, and it was just, you go stir crazy. And it's a lot. So I definitely felt burnt out then. And at that point, it was just kind of, you just power through it and you just tell yourself there's a light at the end of the tunnel. It's just sometimes in medicine and in life as an adult, you just get presented challenges where like it's going to suck. You're going to have to do it. You're going to get through it. And so you just push yourself. Um, Another time I got burnt out was in residency. And it was when we had a particular resident who was doing very poorly and causing a lot of potential harm to patients. And so we were constantly watching that resident like a hawk and trying to correct everything before harm actually reached the patient. So it was like doing 3 times the labor, basically. And it was just really exhausting and daunting. And for that, honestly, a lot of how we got through that was just supporting each other through it. All the other residents, we just turned to each other and vented and talked to each other and just like communicated to each other like, hey, this is happening. I physically can't do this right now. Can you do it for me? And we just pick up the slack for each other.
I think I think it's really important that you said like the importance of like the companionship part of medicine. Like I think a lot of people think that like being a physician is just like some sort of solo career, but I think it's really important what you just said about kind of having friends, the importance of having people to support you through the journey. So I think that's a very important thing to highlight. So thank you for that.
Yeah, I think it's one thing to help with burnout because it's easy to feel like you have to carry the responsibility of everything on your shoulder, especially as a primary care doctor. Um, but it's important to be able to vocalize your limitations.
Completely agree. What advice would you give to some students who are interested in medicine but don't really know where to start?
Yeah. Well, first things is school. I mean, you got to get the good grades. But in terms of like you're in college and you're trying to figure out what do I do to make my applications look good and stuff, you can start with talking with your school counselor first of all. They're going to have a lot of resources for you and they're going to be able to look at like where you are academically and see how competitive you are for med schools and give you advice on like what you might need to make yourself more competitive. You're all going to hear a lot of things that other people did to get in, and you're going to all think that you need to do it. You're all going to think you need to get like a 5 point whatever GPA. I don't even know what GPAs are anymore. You're all going to think you need to get certain test scores. You're all going to think you need to get like all A's in college for all your STEM courses and your bio majors and whatnot. And you're all going to think you need to volunteer and shadow and do research. And yes, that's all stuff that is that looks great on your applications. They're all other than the grades, like all that extracurricular stuff, technically is volunteer. So they're not officially required, but everyone's going to do it. So unofficially, it's required. And because of that, everyone does it. Everyone looks the same. So don't feel pressure to do all these things. If it's stretching you too thin, stop, drop one of them. Like your grades are the first thing that gets you through, get someone to look at your application. So if anything's impacting your grades, drop it. You don't need it. You're not going to be looked at if your grades aren't meeting the school's criteria. And don't do things that you don't enjoy. So all those extracurriculars are really nice, but they're really meaningless if you don't learn anything from it and can't grow from it and talk about it in your interview. Those extracurriculars end up being topics that med schools, residencies, etc., want to talk about in the interview. And if you can't have an engaging conversation about the thing that you spent a year doing, then that was pretty much a waste of your time. So make sure you do things that are interesting to you so that you can grow and learn from those experiences.
Next question. What are some of the most common simple cases you see on a daily basis?
Well, in Southern California, anxiety is common. Everyone is very stressed out. So that's a common one that I have to deal with. Pain, as I see the elderly population, back pain is the bane of my existence at times. Arthritis, everyone has it. And high blood pressure, that's another one that I see all the time.
What's your, like, do you prefer doing these procedures or do you like the more clinical aspect?
I like both, honestly. It's more about balance for me of like left brain and right brain kind of thing. I've always been someone that likes doing hands-on things, but I don't want to. I'm also not the most coordinated person, so I can't rely on a career of hands-on activity. But but like purely doing clinical, like knowledge-based things is exhausting for me. So being able to do a little bit of both has really been a good balance for me.
Yeah, that's really great. I think that that balance is super important, especially in a career as long as medicine. I think it's really important to find a sort of balance. For our last question, when did you know you were ready to do your first patient checkup or visit independently?
Surprisingly, probably within the first couple months of residency. I had great teachers there who really helped me with my confidence. Because you're going to learn everything you need in medical school. It's the confidence that you need help with. Within a few months of my intern year, I was like, okay, I can do this. If something happens, I have these safety nets. If I don't, and then I was also just comfortable with telling people, like my patients, by then that like if I don't know something, I'm going to tell them, and I'm going to tell them I'm going to take some extra time to find out because I'm a resident and it's my time to learn. And we're in medicine, you're forever learners. So
Yeah, that's great advice. I think confidence is super important, one of the most important skills. I mean, you can't really do anything without confidence. So
yeah. Well, it's a balance. You need to also have, you don't want to be too confident and
not
start
arrogant.
doing things that you're not fully prepared for. So you need that balance of confidence and humility, so that if you need help, you know how to ask for help. I just want to remind you guys too, like, don't forget to be kids. Don't forget to have fun. Because it's when you're having fun that you learn the best and you retain things best. And just you don't need a rush. You got plenty of time to be stressed out the rest of your life. You don't need a rush.
A lot of us have a lot of trouble recognizing that our time is limited and I think we need to spend it really wisely. So I completely agree with that.
Enjoy the years where you don't have to pay taxes.
Well, thank you so much for doing this with us. We really appreciate it.
Of course, anytime.
Hey everyone, thank you for watching our video. For more information, check out the link in the description at healinghandsmentorship.org. Click the link down below for our student interest form, or click here for more videos.